All right, so we're back on live again. Of course, well, sorry to all of our viewers that missed this particular part. So hopefully they'll be able to see it now on the Facebook and also on YouTube. Right, so just join us for a few minutes again, just 15 minutes. Right, so Mr. Diaz, you will finish up the information on what you were sharing. You may have to start over on some of that information as well.
Well, yeah, I think we were basically discussing, uh, you know, inflammatory conditions and herbs that basically help these conditions. All right. One of the things that I would like to reiterate, because I'm not too sure if our viewers actually got this, is the fact that if it is that you're dealing with any type of disease, it doesn't really matter what it is, especially if you're dealing with inflammatory conditions. You have to take into account that there are certain foods that definitely tend to add to the problem of inflammation. All right. And when I say certain foods, I'm basically targeting sugar. All right. Sugar is pretty much the worst food that you can actually put, in your mouth when you're dealing with any type of disease. All right. Especially uh, conditions that are actually inflamed. All right. If it is that people are willing to make the necessary sacrifice, get off the sugars within a very short space of time, and I'm talking about days, all right, you should start seeing some real favorable results. But of course, if it is that you're hooked on the sugar, you're using a lot of sugar, and you are basically trying to take care of any inflammatory condition, what will eventually happen there is that you may get some results because of the prolozone therapy. You may get some results as a result of the use of certain herbs, but those results are going to be short lived because what you're doing is basically you are putting in the same thing that you should be getting rid of. All right. So if you really want to get lasting results, you want to make some serious changes where diet is concerned. All right, that is a very important factor. And as long as you can correct the diet, get rid of the sugars and stuff like that, then I think you are giving yourself the best chance so that prolozone therapy and other therapies definitely can do its part in bringing you to full healing. All right. Now, there are two very common herbs that are pretty much used to take care of inflammatory condition. If you're talking joint inflammation, that's one thing. Uh, just a moment, please. All right, let's use here. All right, so if you're talking joint inflammation, uh, you you wanna deal with ginger. Ginger is fantastic for dealing with joint inflammation. But if it is that you are talking about inflammation of the tissues, then turmeric will definitely be your thing. All right. So we have ginger and we have turmeric. All right. Now, how do you use these herbs? So, or what is the most successful way of actually using these herbs? Well, really, really simple. All right. Basically, you could simply crush either the ginger or turmeric, depending, of course, on where the inflammatory condition exists. All right. You can crush the ginger or you can crush the turmeric. The turmeric will be placed on tissue damage, okay? And you can place it there and you can basically band it there and you leave it there overnight, or you can leave it there pretty much throughout, even throughout the day, okay? And turmeric does a fantastic job of taking care of inflammation of the tissues. If you're talking joint inflammation, again, you're doing the same thing with the ginger. You're basically crushing the ginger. You can place it on the knee or the shoulder or wherever the uh, condition has become inflamed. You place it on the joint and you basically fasten it there with the use of maybe a cloth, and you band it, and you just leave it there overnight, or you can leave it pretty much throughout the day. All right, and you find that these basically help to pull inflammation out of the joints. All right, another thing you can do is that there's the Irish potato. You could do a poultice of the Irish potato and ginger. You can probably put both of them together, and these are also very good for taking care of inflammation in the joint. The Irish potato does a really good job of removing uric acid from the joints and also from the tissues. Okay, so these are three simple herbs that you get pretty much in the kitchen that can go a long way, all right, in terms of helping to take care of inflammatory conditions.
Right. So definitely, there's a lot of help that persons can get when it comes to prolozone therapy. This is just the closing of statements from the other video. Now, diet-wise, definitely we want to eat certain foods that will increase healing. So you talk about lots of greens, kale, spinach, broccoli, cabbage, things like cauliflower. Actually, could give a little example of cabbage itself. Some persons might have severe pains in the knee, the back, the hip. I remember playing football and a ball hit me in my eye. What I did, I took the cabbage leaf, a large one, and I put it in water, I boil it a bit, or you can just pass it over the stove and it heats up. With the heat, I rest it over the eye, and within by the next day, the swelling went down completely. So a simple thing as that to help with pain or to help with swelling, that's something that works pretty good. So prolozone, of course, if persons need more information on prolozone itself, we'll be able to continue to share testimonies. So look out for more on this particular topic itself. It's a broad topic, and we're going to be touching on knee pains, back pains, hip pains, pain in the wrist. So much information that you can actually get from that. So as we look at the different conditions that it can actually treat, you're looking at shoulder pains, torn rotator cuff injury, shoulder itself, tendonitis, tendon tears. So definitely, I have seen how this particular treatment actually works for myself. So I can tell that it actually works pretty good, and then it have other persons who would have their information. So Mr. Diaz, you could give you a closing comment, and then we'll be able to bring this to an end.
Yes, well, definitely our health, of course, is in our hands, and really and truly, pain is actually, or it should be, a very good deterrent, to us. Pain actually helps us to make sometimes hard decisions, stuff that you will not normally do if it is that you weren't experiencing pain. You are forced to do certain things when you find yourself in a situation, where you are overtaken by pain. But the thing about it is that in most cases, we could actually avoid these type of cases. Lack of knowledge, of course, leads us or puts us in a position where we sometimes will do things that will not work in our favor. But if it is that we are going through pain, I would say definitely that there is always a way out. We owe it to ourselves, basically, to get more in touch pretty much with how the body works, and there are certain things that we can do, especially where our diet is concerned, diet and lifestyle. There are certain things that we can do that can help to alleviate, you know, pains and stuff, you know. But even as we try to make the best decisions, moving forward, whether we choose to do prolozone therapy, whether we choose to do some other therapy, the thing about it is that we want to understand that the decisions that we make basically could determine our future, whether it's a painful one or whether, the decisions that we make can actually bring us pain relief. All right. But joints, when you're dealing with your joints, if it is that we allow our joints to get to the point whereby it is damaged badly, possibility is eventually you get to the point whereby you can't walk anymore, you can't use your hands anymore, you can't use your shoulders anymore. And that is really a sad thing to really allow us to get to that point. Some people may think that, hey, you know what, this is too expensive or that is too expensive, but we really need to consider what is more expensive. I don't know. Sitting in a wheelchair, laying in bed, uh, is that worth the price at the end of the day? All right, but I suppose in reality, what I'm saying is that as we move forward, let us try to make the best decisions possible. Let us do what is within our power to do, and as we endeavor to take care of ourselves, all right, let us not put ourselves in a position whereby we are spending money, we are putting things in our body that will not benefit us, and at the end of the day, you know, we don't get to the point whereby we try to make decisions when the situation is far gone, or sometimes when it's too late. So there is no time like now for taking care of the situations that we are faced with. So for all the listeners out there, all right, prolozone therapy, I would definitely say that, it is my best recommendation. All right. It definitely has a pretty high success rate, So as we make changes with our diets and everything, all right, we can definitely implement prolozone therapy. This is something that by God's grace, I believe can really be useful to us. All right. And that there's my closing statement pretty much for today.
All right. Well, of course, persons can join us live again at around 2:30 for our radio program. All right, which is on 95.5. I'll be able to share that on here again. All right. So God bless and take care.